Good morning, Miss Hutchinson. My name is Gloria. I'll be your nurse today. I'll be doing a head-to-toe assessment on you. Do you prefer to be called Miss Hutchinson or Brantley? Brantley. All right, Brantley. I'm gonna wash my hands. Water got in my hands. And I close the door to provide privacy for you. Dry my hands. And this exam is confidentiality, and you do have a right to refuse. Do you want to go ahead with the assessment? All right, let's get started. The first thing we're gonna do is we're gonna assess and inspect your face and your scalp. Have a beautiful smile. I have to put some gloves on. Let me grab some gloves. Okay. All right, we're gonna first start with your scalp. I'm gonna just move this table a little closer to you in case you want to get to your trim. You won't have to overextend yourself. And all I'm gonna do is feel, look. You have an evenly distributed hair, no baldness, no thinness, nothing noticed, no bumps, no palpation, none, no masses, non-tender to touch. Your skin is beautiful, no blemishes is noted. You're a pretty girl. I'm gonna use these two fingers, and the only thing I'm feeling for is your temporal pulses. They are intact, non-bounding, 2+. While I'm touching you, I'm also gonna check your TMA joint. I need you to open and close your mouth, please. They are intact. Thank you. No tenderness, no clicks noted. Now we're gonna check your cranial nerve 5. You're in a great position. Uncross your legs. Chin up, please. I need you to do a couple things for me. I need you to clench your teeth. While your teeth is clenched, I'm gonna go ahead on. All right. Cranial nerve 5 is intact. And next I want you to close your eyes. I want you to tell me when you feel this and where you feel it.
No, left cheek.
Is it soft? Hard? Good.
Now forehead, soft. Now soft right cheek.
Good. Keep your eyes closed for me.
Hard forehead. Hard left cheek. Hard right cheek.
All right. You may open your eyes. I hope that didn't feel too bad. Now we're going to do cranial nerve 7, where we're going to evaluate your motor function. I need you to raise your eyes. Thank you. Close your eyes. Thank you. I need you to buckle. Blow your cheeks out. Let me see your teeth. Smile. Smile. Frown. You have a beautiful smile. Next, I need you to, we're gonna do the eye chart. And my eye chart is based on 10 feet. And I've measured out 10 feet. So this requires standing. Are you okay to stand? I need you to stand at the head of the bed for me. This is the Snellen eye chart. And I'm gonna walk over to the eye chart. I need you to, the lowest line that you see, call out those letters for me, please.
F, D, F, L, T, C, E, O.
Thank you. That is 20/20 vision. You have good vision. Next, we're going to do, we're gonna monitor nerve 3, 4, and 6, and we're gonna be looking for extraocular eye movement, and we're gonna test it in 6 spots or 6 fields, and it's called the cardinal field. And what I'm gonna do is hold my finger about 12 inches from your nose. Without moving your head, I need you to follow my finger, please. Thank you. Intact, no extra eye movement noted. She did really, really good. The next thing we're going to do is check cranial nerve number 3, 4, and 6 again, and especially 3 with accommodation. What we're gonna do is Perla with my pen light. I'm gonna hold this approximately 12 to 14 inches from your face, and I just need you to follow it through. Focus on the pen light. Focus on the pen light. Good. Her eyes, her pupils are equal, reactive, and they accommodate to light. They're equal, round, reactive, and they accommodate to light. Thank you for that. I had to get that together, y'all. Next we're gonna do is inspect and palpate the eyebrows. And as you can see, she has beautiful eyebrows. They are full. I want you to open and close your eyes for me. Leave them closed. Her eyelids are well closed. Her eyelashes are beautifully distributed. Next, we're going to palpate her maxillary and her frontal sinuses. No pain or tenderness noted, and everything is symmetrical with the skin intact. Next, we're going to look at her eyeballs and inspect her eyes. I'm gonna apply pressure, or not pressure, but I'm gonna touch your face. I'm gonna look up. I'm checking her conjunctiva. It is moist and pink and intact. Open your eyes for me. Her pupils are brown. Her iris are brown. Her pupils are white. Yeah. Your sclera, I'm getting myself mixed up. Her sclera is white. Her pupils are brown. Her irises are clear, non-cloudy. They are symmetrical, and she's not having any pain with palpation. Her conjunctiva is pink and intact. Next, we're gonna move on to the nose. Her nose is well approximated, it's symmetrical with no septal deviation noted. First, I need you to occlude the right side of your nose, sniff. Occlude the left side of your nose, sniff, and her nose is pale. Next, we're going to go on to her ears. We are going to palpate and examine her ears. Her ears are symmetrical. They do not appear to have any broken areas. The skin seems to be intact. And they are non-tender. Next, we're going to inspect the mouth and the throat. With my pen light, I need you to open her tongue, and her oral mucosa is moist, pink, and intact. Her teeth are intact. She has a beautiful set of teeth. Her hard palate is intact, pink, and her soft palate is intact. Raise your tongue. The floor of her mouth is intact, moist, and pink. Next, I'm going to take a tongue blade, and I'm going to be looking at the back of her throat along with her tonsils and her uvula. I'll be asking her to stick out her tongue and say the word ah. Get your tongue out. Out. Say ah. All right. Her gag reflex is intact. She has a really good gag reflex. Her tonsils is O2. They are pink. They do not have any kind of, her tonsils are grade 2. Sorry about that. She has no redness, no exudate, no inflammation noted. They are intact. Her gums are pink and with no bleeding and no abnormalities noted. When she said ah, her uvula did vibrate with movement. So her mouth is looking good. We're gonna next, I've already evaluated cranial nerve 11. When she stuck her tongue out, she was able to stick it in and out without any problem, and it was done symmetrically. Next, we're going to evaluate her lymph nodes of her neck and her head. Sorry about that. We're gonna start from in front of her ears, work our way down to her jawline, and then we'll work our way down the neck. I'm gonna do it using 2 of the pads of my finger, and we do that in a circular type motion. Okay? First, we're gonna do preauricular, then we're gonna do tonsillar, submandibular, submental is right underneath the chin. Behind her head, we'll do the occipital, and then we'll do the superficial cervical. We'll go down doing deep cervical, and deep cervical is hard to palpate. Turn your neck, please. Turn your neck to the other side, please. Then we're gonna do the posterior cervical and the subclavicular. Okay? They are non-tender, non-palpable. Next, we're gonna do cranial nerve number 11, where you in a sitting position. I need you to put your neck to your chest. Raise it back in place. Turn to the right. Turn to the left. Turn to the right. To the left. Thank you. Head to shoulder. Thank you. Now I need to do it with resistance. Try to move against my hand. Thank you. Move against my hand. Thank you. Shrug against. Thank you. All cranial sheaths, they're intact. No tenderness noted. Next, we are going to move to the thyroid and to the trachea, and we're just going to palpate the trachea. It's midline, no masses felt, non-tender. Then I'm gonna give her tea, and I'm gonna ask her to swallow. We're palpating the thyroid. I need you to swallow. Nothing, non-tender, no masses palpated. We're gonna palpate the carotid plexus. Turn your head, please. Good, turn your head, please. Carotid plexus are palpable to fluff. And now I'm gonna listen with the veil. Turn your head, please. Good. Turn your head, please. No brewing noted, no swishing, regular beat noted. Next, we're going to In palpate, we're going to inspect and palpate the chest. What we're going to do is I'm going to do it on the front and on the back. I am going to look at your chest now. Thank you. Her chest is intact, skin is intact. Her expansion is symmetrical, in and out movement, no distress noted. She is, okay. We're palpating, percussing. Now, 99, 99.
99.
It is symmetrical, no pain, no tenderness noted. Chest expands symmetrically. Next, I'm going to also take the breath sounds, which means I'm going to listen. I'm going to ask you to breathe in and out for me, please. Okay. Again, in and out. Lungs are clear. Again, symmetrical. No working noted, no use of accessory muscle. Next, we're going to inspect the upper extremities. We're going to be looking at the arms and palpating the arms. Can I check your arm? The skin on her right arm is intact all the way down. The skin on her left arm is intact all the way down. No broken areas, no cuts, no bruises noted. The skin temp is warm to touch. We're going to palpate some pulses. First, we'll do the brachial pulse. Then we'll do the radial pulse. If you don't mind, may I remove your watch? And then we'll do the ulnar. Intact, brachial, radial, ulnar, bilateral, 2+. Next, we're gonna test the range of motion, and that's where I'm gonna ask you to raise your hands above your head. Yes, please put your shirt back on. But you know later on you're gonna have to take it off again.
That's fine.
Okay, as long as that's fine with you.
Okay. What?
Raise your hands above your head and bring them down here. Raise them behind your back. Abduct, away, adduct. She has range of motion, no problems moving around at all. She has great range of motion. Next, we're gonna ask her to bend your elbows, bring them to you, flex them, extend them, flex them, extend them. Thank you. And then we're gonna have you to pronate, supplement, pronate, supplement. Now we're gonna do it with resistance. I want you to try and bring it good. I want you to try. Good. She has great strength bilaterally on pronation and suppulation, on supination. coordination. She's able to abduct and abduct without any problem. She's able to flex and extend. She has great range of motion, both with and without resistance. Next, we're gonna do range of motion with her wrist, arms, and fingers. And then we're gonna check her cerebellar function by extending her fingers to her nose. Let's do that first. Can you push back against me? Good. Can you push back against me? Good. Okay. Take your nose, your finger to your nose, good. Your finger to your nose, good. All right. Now, I want to check your strength. I just need you to squeeze my hand. Good. That's good. Good strength. She has good movement. She has good function from her finger to her nose. She was able to pronate. And now we're going to do some tests that require you to close your eyes. First of all, we're going to do the one it's called graphesthesia. Close your eyes for me. I want you to hold your hand up. I'm going to write something on your hand, and I want you to tell me what figure or what did I write, okay? I wrote the letter 8. That is correct. 6. I wrote the letter 6. That is correct. Now I need to do stenography, in which I will place an object in her hand, and I want her to tell me to best describe this object for me.
Circular and
okay. Which hand was that?
Right.
Okay. I'm going to do the same thing in your left hand. Tell me what that is.
Paperclip.
Okay. She is intact with feeling. Next, we're going to check her reflexes on her triceps, her biceps, and her brachial. I need you to raise your arm kind of loosely. Okay, on the right side, all 3 are intact. 2 plus the brachial, the tricep, and the bicep. On the left side, kind of hanging free. Okay, on the upper, both left and right, tricep, bicep, and the brachial are all 2 plus intact. Next, I need you to lie down for me, Miss Brantley. We're gonna be doing some stuff to you. I'm gonna inspect and palpate your breathing or your chest. Right now, her breathing is even, non-labor, no use of accessory muscles. She's doing fine so far. How are you? Do you need anything? All right. First, we're going to inspect and palpate your pericardium for inspecting and palpate your precordium for PMI, which is your point of maximal impulse, pulsation, heaves or thrills. I don't see any heaves. I'm gonna any thrills. I'm gonna palpate for thrills. I see no heaves, and we'll just go from there. How about that? This soft palpation. Your point of maximal impulse is mid-clavicular at the 5th intercostal space. No pulsation, no heaves, and no thrills noted. Next, I'm gonna auscultate. And I was watching her facial movement during the whole palpation process, non-tender noted. Next, I'm gonna auscultate her aortic, her pulmonic, her tricuspid, and her mitral. I'm gonna do it using the bell side first and the diaphragm side next. We're gonna start at the second intercostal space and do the aortic, the second intercostal space and do the pulmonic, the fourth intercostal space and do the tricuspid, and the fifth intercostal space and do the mitral. Okay. Intact. S1, S2, no switching noted. And that was with both the bell and the diaphragm. Next, we're going to inspect the skin of the abdomen. I'm going to raise your shirt, Miss Brantley. Her abdomen is intact. I'm inspecting it first, and then I'll listen, and then I'll palpate. But her abdomen is intact. There is no broken areas, no bruising, nothing noted on that. And then I will listen to her bowel sounds, and then I'll palpate. Bowel sounds are positive in all 4 quadrants. Next, I will palpate. I'll palpate lightly first, and then I will listen. No, first I will percuss, and then I'll palpate. So we'll percuss first, and I'll start at the lower right quad and work my way over to the lower left quad. Resonance, no, there's non-abnormalities noted. Next, we will do light and soft palpation. Non-tenderness noted in all 4 quadrants. No masses palpated. Notice in the patient's face, she did not grimace, so I'm to assume nothing tender noted. Now we're going to palpate the liver. No masses. Liver is non-palpable. Next, we're going to inspect the lower extremities. We're going to inspect them, and then we'll palpate. No broken areas noted. The skin is intact. We'll palpate. No swelling noted. No pretibial swelling noted on left or the right leg. Next we're gonna do the popliteal. The right popliteal and the left popliteal is intact. The right posterior tibia and the left posterior tibia is intact. The right and the left dorsalis pedis is intact. And now we're gonna test for range of motion on the lower extremities. First, we're going to test for range of motion on the hips and the knees. I want you to raise your left leg about 90 degrees, your right left leg about 90 degrees. Thank you. Raise your right leg about 90 degrees. Thank you. Take your right leg and lift it knee to chest. Thank you. Knee to chest. Thank you. Now I need you to rotate your hips by pointing your knees in and out. One at a time. In. Oh, thank you. In. Thank you. And then I want you to take your legs, abduct, away, adduct back, abduct away, adduct back. Thank you, you did good. Range of motion is excellent. No clicks, no rubs noted. No facial expression made, so non-tenderness noted. Range of motion is intact to bilateral lower hips and bilateral lower knees. Next, we're gonna check for bilateral ankles and feet. I need you to dorsiflex your feet, plantarflex your feet, rotate your feet outward, rotate your feet inward. Thank you. Now, against resistance, I need you to pull back against my hands, and I need you to push back against my hands. Her strength in her lower extremities, her feet, is intact. Range of motion is intact. I need you to invert, exvert. Thank you. You did good. Range of motion again is intact to bilateral lower extremities. Next, I'm going to check some reflexes. I need to check your patellar reflexes. I need to check your Achilles reflexes, and then I need to do the Babinski's. You're just gonna come down to your patellar tendon. Okay, patellar tendons, 2+ on left and right, 2+ Achilles reflexes on left and right, and a negative Babinski on left and right. Next, we're going to have the patient, we're gonna check your cerebellum, okay? And what I need you to do is take your left heel and run it along your right shin. And then I need you to take your right heel and run it along your left shin. Cerebellum function is intact. Her skin is nice, warm, and intact. She has no problem with her lower extremities. Next, are you okay? The next thing we're going to do is, require standing. Are you okay to stand? Okay. Standing up, I need you to walk on your heels. Good. Now turn around and walk back. She has no problem with balance. She's able to walk to and from on her front and her heel. Next, we're gonna do something what we call a rumbar test. I want you to put your hands at your side with your eyes open, and we're just gonna stand right here. Notice that she did not sway. She is perfectly balanced and coordinated. Now I want you to close your eyes. I'm gonna put my hands in front of her and in back of her for safety. Notice again, she did not sway. She is well coordinated and well balanced. Open your eyes, Brantley. I now need you to hop on one leg. Thank you. Hop on the other one. Thank you. Coordination again. She has no problem bouncing on one leg or the other one. She is well coordinated. Next we're going to inspect your spine. And I need to do that by turning to the right. I'm gonna ask you to lean forward and bend over. Her spine is well approximated with the right curvature. No masses noted, non-tender to touch. No tenderness noted. Now I need you to bend over and touch your toes. That was rather quick. How your back feel after that?
Good.
All right. Then I need you to bend to the side, to the other side. Thank you. Bend backwards. Thank you. Now I need you to twist your shoulders from left to right. All right. How do you feel? Any pain?
No.
Anything? No. Do you have any questions, Miss Brantley?
I don't.
Have a seat on the bed. I know that you're in school, and to be in school, you're a healthy young mind. I want you to stay encouraged and do well. And this concludes our assessment. Thank you.